It's World Hepatitis Day. Today, July 28th, is seen as an opportunity to step up national and international efforts on hepatitis, encourage actions and engagement by individuals, partners and the public. It is also an opportunity to highlight the need for a greater global response as outlined in the WHO's Global Hepatitis Report of 2017. The date of 28th July was chosen because it is the birthday of Nobel Prize-winning scientist Dr. Baruch Blumberg, who discovered hepatitis B virus HBV and developed a diagnostic test and vaccine for the virus. Low coverage of testing and treatment is being said to be the most important gap to be addressed in order to achieve the global elimination goals by 2030. Dr. Nseabasi Ekanem is the National Coordinator, Civil Society Network on Viral Hepatitis in Nigeria, and he joins us now from our Abuja studio. Good afternoon and welcome to Newsday.
Good afternoon. Thank you, Nii, for having me.
All right, Doctor, let's talk about the seriousness of the issue of hepatitis in Nigeria at the moment. How concerning is it?
All right. Hepatitis is a very serious public health threat, not just to Nigeria, but to the entire world. At the last count, we have over 300 million people living with viral hepatitis B and C across the world. That's a very huge number, and that's far more than the number of people living with even HIV and many other very deadly diseases. In Nigeria, at the last survey that we did in 2019, the NICE survey, we noticed that up to 20 million Nigerians, that's accounting for close to 1/10 of our population, are infected or living with viral hepatitis. And every 30 seconds, one person dies of viral hepatitis. And to make that worse, every year, 2.2 million people get newly infected with viral hepatitis B and C. So it's a very serious problem for us as Africans, and it's more of a greater problem for us as Nigerians. Because for a country that has more than 10% of its population living with viral hepatitis is a very, very serious concern. And what is most worrisome is that less than 10% of the people living with viral hepatitis in Nigeria know about the disease or even know about their status. So despite the fact that treatment, the cost of treatment has been reduced thanks to international organizations like World Health Organization and many other partners, even the diagnostic tools or diagnostic equipment the costs have reduced. But unfortunately, people still don't have access to this diagnosis. They don't have access to affordable, treatment. And this is one of the things that have stalled elimination activities as far as hepatitis is concerned. So for us, it's very worrisome. The awareness in Nigeria is extremely low. I can tell you that over 90% of people in Nigeria don't even know what we call viral hepatitis. And when the awareness is low, how then would they go for screening? How then do they go for diagnosis? How do they even go for treatment? So this is the dire situation we have in Nigeria. And today being the World Hepatitis Day, with the theme, it is time for action. That means enough of the rhetorics. Let us start actually implementing elimination activities, just like countries like Egypt did, just like countries like Rwanda did. We can eliminate viral hepatitis, but we need to take action. The government, the private sector, even the civil society organizations, international partners, we need to come together and address the problem of viral hepatitis in Nigeria. This is the main concern that we have, that people are dying of viral hepatitis every 30 seconds, but nothing tangible is being done to eliminate this particular disease. This is the concern in Nigeria today.
Indeed, Dr. Ekanem, and thank you for setting the tone of this conversation. When we speak to the theme of this year, it is time for action, and we look at the low coverage of testing and treatment. The WHO's Global Hepatitis Report highlights this very low coverage and treatment as a major gap So what steps should the Nigerian government be taking to improve this coverage? And how are civil organizations like yours contributing to increasing testing and treatment rates for hepatitis in Nigeria?
Yeah, thank you very much. The government has a big role to play because, first of all, the goodwill of the government can help us attract the interest of development partners, donor agencies, philanthropists. I think the government should set the record straight, should set the ball rolling by bringing together all partners from international donor agencies, international development partners, bring in the private sector, research institutions, bring in even the media to help us in disseminating information, bring in civil society, bring in healthcare providers, and even insurance system, insurance scheme to say, look, we have a problem at hand. How do we address this problem? First of all, the National Health Insurance Scheme should be able to capture hepatitis diagnosis, hepatitis treatment, and even birth dose vaccination for viral hepatitis. That's the first thing first. The Nigerian Ministry of Budget and Financing, Ministry of Budget should be able to allocate enough budget in the Ministries of Health budget for viral hepatitis in particular. During the Cairo Declaration, Nigeria was a signatory to that declaration, which mandated us to actually implement activities, increase funding for viral hepatitis so that we can close the gap in terms of viral hepatitis. We should be able to ensure that we fully integrate viral hepatitis services into the primary healthcare system. We must ensure that all pregnant women have access to hepatitis screening during antenatal visit, so that would help to ensure that pregnant women don't pass on this virus to their unborn children. Because one of the major mode of transmission of viral hepatitis B in particular in Nigeria is through perinatal transmission from mother to child. And this can be reduced if, first of all, we allow birth dose immunization to get to every child, every infant. Every infant in Nigeria should have access to universal birth dose vaccines for viral hepatitis. Secondly, during pregnancy, the WHO guidelines stipulates that antiviral prophylaxis should be administered to every hepatitis B positive mother. What that helps to do is to ensure that while a woman is pregnant and she is infected with hepatitis B, she does not transmit this virus to the child. By giving antiviral prophylaxis, it will reduce the viral load in the pregnant woman so that she does not transmit the virus to the child. And when the child is eventually born, birth dose vaccine can be given to the child to give a lifelong immunity. That is as far as vaccination is concerned. About diagnostic, the government can work with diagnostic facilities. First of all, ensure that diagnostic equipment like gene expert machine for viral hepatitis are brought into the country at a very affordable rate so that patients can have access to affordable diagnosis at the time they need it. Then, of course, in terms of treatment, the government can work with pharmaceutical companies. We have over a $1 billion pharmaceutical company in this country. A lot of them import antiviral agents that are used for treatment of viral hepatitis. The government can work with them to see how they can bring in this product at a lesser amount. And the government can also do counterpart funding to ensure that patients are able to access hepatitis B treatment at a very affordable rate. Hepatitis C also even has a cure. Why can't the government of Nigeria, like the government of Egypt, say, okay, we are going to fund hepatitis C treatment, cure, to ensure that everyone that is living with hepatitis C can access cure? That is what the government of Egypt did. And the government of Nigeria can do same too. And lastly, the government can work with the media and the National Orientation Agency to say, let us send out the message out there. I can guarantee you that across hospital, across everywhere, message about viral hepatitis is nowhere. And that's why you see patients that are even living with the virus telling you, is it hypertension, when you tell them about hepatitis, because they don't even know about it. We need to strengthen awareness. And that is what the Civil Society Network on Viral Hepatitis is doing. As I speak to you now, Our network in all the 36 plus 1 state in Nigeria are implementing awareness activities. We are implementing sensitization workshops across the 36 states to inform people, to educate people, to sensitize people about viral hepatitis, about the need for them to go for screening, get tested, get treated, and or get vaccinated. That is the message, and that is the role that we are playing as civil society. But the government has a bigger role, because the government need to lead from the front. Bring these international donors, bring this private sector, bring this research organization, bring everybody to the table. Let us discuss hepatitis. Let us support the elimination of viral hepatitis in Nigeria. It's simple.
Interesting development there. Dr. Ekanem, looking at the theme, it is time for action. What comes next beyond observing World Hepatitis Day? You already mentioned the issue of awareness and, of course, the issue of enlightenment as well. But it's just one day. What happens next?
Yes, for us as civil society network on viral hepatitis, awareness on viral hepatitis is an everyday thing. And that is why we are calling on all concerned stakeholders. Let's not limit this to just World Hepatitis Day. From now, we will be moving to different parastatal, we'll be meeting with several stakeholders to ensure that we keep this engagement going. We will keep sustaining this momentum to ensure that priority is given to viral hepatitis. We'll be visiting state governors, we'll be visiting legislators, we'll be visiting agencies, ministries, and departments of government to say, let us see how we can increase funding. I keep stressing funding because HIV, malaria, tuberculosis, family planning, all of these have funding from international donors. The Global Fund, PEPFAR, all of those initiatives fund these programs, these disease areas. But hepatitis does not have any. And it kills more people than these, the aforementioned diseases. 1.3 million people die every year from hepatitis. Why shouldn't the government of Nigeria say, okay, since we don't have much international funding for hepatitis and it's affecting our people, let us take up this responsibility. Let us fund it heavily and ensure that we are able to eliminate hepatitis. We are going to be engaging. After today's World Hepatitis Day, we are going to be engaging different stakeholders across all levels, from federal, state, and local government level, to ensure that adequate attention is given to viral hepatitis. The truth is, if we don't stop hepatitis, I can tell you for a fact, it will stop us. My brother died of viral hepatitis in 2020. A lot of people are dying. This is not statistics. These are people that have died of viral hepatitis. We cannot allow this to continue. We need to stop it now. And that's why we'll continue to engage. We'll come to the media from time to time. And I pray that Arise will give us that opportunity to use their platform to reach out to the government, to reach out to people, to reach out to philanthropists, to say, look, come and support us. Come and invest in viral hepatitis elimination, because the return on investment in viral hepatitis is 1 to 12. For every $1 you put into viral hepatitis, $12 is gotten back as return on investment. This is something we need to actually give attention to. And that is why we are going to continue to engage until the Nigerian government, until the private sector, until every stakeholder involved in hepatitis elimination start paying attention to this cankerworm, to this threat. And we know that someday, very soon, possibly before 2030, we will be able to eliminate viral hepatitis if we put in the right action in place.
All right, then. Thank you so much, Dr. Ekanem. We'll keep, of course, monitoring this story. Thank you so much for being here.